This is a pose we're talking about.
With poor posture, you'll end up with bad backs, bad posture.
How achieve a beautiful asana?
The lower back is always the most affected for us. That is, they used to insert special rods into the spine. They would check for a lot of fat, little muscle, and so on. Nutrition affects the spine.
A standing desk, a treadmill. And the person walks and works.
The more uncomfortable it is here, the better. I'd start by saying it's important to get enough sleep. No recommendations. These are the system requirements for your back.
Then hi.
Hey Vlad. Hello.
Thank you so much for coming. Tell me please, what would be the best way to introduce you?
Well, paradoxically, I call myself a physical rehabilitation specialist, a massage therapist, a manual therapist, sometimes a kinesiologist, and so on. Basically, I do sports and orthopedic rehabilitation after injuries, after pain, and so on. In simple terms, I treat pain in the back, joints, neck, legs, and arms. Basically, anywhere it's possible, specifically when it comes to soft tissues.
Most of my podcasts are actually about IT specialists. But I realized I wanted to do something truly useful for people who spend a lot of time at their computer and often experience pain in their back, neck, or really anywhere else. And the first question I wanted to start with is, what do people most often come to you for?
If I answer what I do now and what people most often come to me for, it has become IT specialists, because among relocated people, there are many who work not only in IT, but generally in digital products, digital professions, what I call sitting professions, and so on.
I can't help but ask. I often notice myself when I'm sitting on the couch with my phone, I end up in this kind of goat-like pose. Do you need to control that?
How much you need to control it depends on how much it bothers you. If you watch too many tips on Instagram because it causes, this is what I really like, people say that poor blood flow to the brain is a huge problem, that it's basically a stroke. Poor blood flow to the brain is a stroke, and when you try to treat poor blood flow in your head, you're usually just doing some nonsense. People often think they're pinching some arteries, but if arteries are actually pinched, that's it. If blood doesn't get to your head, how can you even imagine that? These are just typical scare tactics, but that's all they are, just scare tactics.
But could a double chin form?
If we eat a lot at KFC while doing this, then of course it could. Still, a double chin is usually the result of poor posture or fat accumulation. If we look at liposuction, when a surgeon removes fat, the double chin disappears right away. Posture doesn't play a role here. It's a straightforward physiological example. If posture were really the key, then liposuction wouldn't always help with a double chin.
I want to talk to you about computer neck. I often notice this distinctive profile in people, especially those who spend a lot of time on their phones. Is it dangerous? Should we try to get rid of it? Is it something to worry about?
This is going to be really quite interesting. It's something you can truly dive into because it's such a very hot topic, correcting our head tilt, which is professionally called cervical hypolordosis. In other words, it's an increased forward curve of the cervical spine. It's believed that this causes big necks. Some people read, for example, Elon Musk wrote that this leads to impaired brain function and hair loss. Yeah, by the way, for those who were planning to go to Turkey for a hair transplant, many will agree, because after all, Elon Musk is considered a serious expert, and you are in this field as well, after all. If we look at the research, there is no study that shows that having a computer at your neck affects neck pain, causes herniated discs, or, even more so, impairs brain function or leads to hair loss.
Logically, this is understandable and easy to explain, and this is called anatomic possibilism.
That is, when we try to explain how our body works using very simple logical constructs. But our bodies are much more complex than we can imagine. If we carefully examine the available data from large-scale studies, there is no clear connection between increased lordosis and chronic neck pain.
Why is that?
I'll explain now. On the contrary, there is even some data showing that the greater the lordosis, the less neck pain people experience.
Really?
Yes, it actually sounds surprising, but that's how it is. In reality, what matters is not the posture of a particular segment, but how little static load there is and how well that segment is trained. For example, let's take one of the main culprits of neck pain in the model, the trapezius muscles of the back. Often, as a massage therapist, I don't just work with my hands. As a movement specialist, I also give exercises and so on. This is a paired muscle that starts at the skull, goes down to the shoulders, and actually attaches to the clavicles, the thoracic spine, and so on. And it's responsible, the upper part of the trapezius, for lifting our shoulder blades upward. And when we sit like this for 8 hours, we experience pain. But it's not because, say, we have bad posture or are sitting incorrectly, but because the muscle has been under static load for 8 hours. It's not big enough to handle that. And of course, if we start training it, for example, by doing shrugs, that is, lifting dumbbells up toward your ears, we will be actively training this muscle, effectively relieving its spasm, and carefully preparing it for the greater load we consistently put on it during the demanding workday. That's precisely why it's important how well trained the segment is and how truly ready it is for the load. And the position it's in, its posture, those are secondary factors, and they definitely don't affect pain. This was a huge debate back in the early 20th century called the mechanical theory of the human body. That is the idea that we are purely mechanical. If something shifts, if we have the wrong angle in scoliosis or lordosis, then there will be pain. But based on scientific data, we've come to a new model called the biopsychosocial model of pain. It includes the idea that not only biology, not just the bio, affects us, but also the psyche and society. For example, if a person has problems at work, their neck hurts more. If a person, for instance, has a low salary, the pain will also be worse. And if someone has family problems, the pain also intensifies, because the brain is essentially the main center for processing information. And pain is simply an informational signal from some tissue in our body to the brain. And so, if we are under psychological stress, our pain can appear just from the workplace, and it doesn't necessarily mean that something is physically shifting or anything like that. Therefore, of course, some mechanical factors do play a role, but at the same time, we also register other parameters. Therefore, if we focus only on having the correct neck shape, we can't determine whether pain will appear there or not. In this regard, what's important is how well trained the segment is, not what shape it has.
So we're currently in the gym right now, and Dan will demonstrate on me precisely which exercises you truly need to do to stay completely pain-free and keep your back healthy and strong.
What should I have remembered first? Which gym are we in? We are
In the gym at the office.
Of Yandex.
Delgrad. If you do it wrong, you'll end up with back pain, hernias, and so on.
Damn.
Can we grab a mat to start? I won't do the exercises myself because my clothes are too restrictive. So, I'm taking
The mat, Rainey.
Listen, we'll start with a light, gentle warm-up and work on all the areas where people who frequently sit at a computer usually experience, let's say, a significant lack of movement.
So,
Basically, the areas that move the least. That means extension in the thoracic, cervical, and lumbar spine, and so on. We'll start with a light warm-up for the neck. Because we always sit with our necks in this position, we can train the neck extensors. And we can actually do this in two ways. First, we'll just do the pigeon movement. That is, move your head as far forward and back as possible. At the same time, make sure your shoulders stay in place. In other words, don't move your shoulders, just move your head. This will work your neck extensors. If we're talking about more advanced exercises, we can add a resistance band. For example, here's a small variation.
yeah, but won't there be a reverse effect where instead of training muscles, I just end up staying in this position? Listen,
These muscles, on the contrary, will get some load. So for them, any exercise will only help.
does this work the neck muscles, right?
No, that's your platysma, the muscle under the skin of your neck.
The work involves the flexor and extensor muscles of the neck.
Look, to make the movement more challenging, you can do this. You put a small basket behind your head and hold it with your hand. And then start doing the same thing, but with resistance. Don't be shy here, go ahead and show off all your chins. How many is that?
5 or 6.
You can count the reps.
Can you use your hands instead for resistance?
Yes, you can use your hands instead, or you can use, for example, a towel. Put it behind your head and start training like this.
I'll try. Is that okay?
Go ahead, try it. The most important thing is to feel how your neck starts to tense up pleasantly. That is, as the neck muscles start to loosen up a bit. I'll try to do the same thing with the band. I put it right on the back of my head. I fix it with my hand about 10 meters, that should be enough. And I start moving my head. Yes, it's important that he already showed 2 variations of this movement. First, I recall I do tilts, up and down, and the second one I showed the forward movement of the neck. Yes, then I try to keep my neck very straight, right now.
Like this.
And you move it forward firstly, and then back then. Yes, so you feel that. Let me show you. You're not tilting your neck down or throwing it back. But you're moving it forward, just like a pigeon. You're not moving it like that, in this motion.
Here, listen. You need coordination because I also want to move my arms at the same time.
Yes, so it's important that the main load is placed specifically on the neck. We're showing several options at once. Mild pain, more severe, and so on. We can get down on the floor with you now.
On
the floor. Feel a damn mess. Your task now. Start pressing under the chin as if to the chest area. Tell me how the exercise feels.
Well, these seem to work.
Yes, including. The brisket also works through the colored muscles and the scalene muscles a little. We don't need to focus on any one specific muscle group. We can train the movement that we ourselves perform throughout the day.
Now,
You can do the exact same thing, just lie back down completely on your back. And start gently turning your head to the left and to the right. The movements are extremely simple, but that's exactly what is missing in everyday life.
and which muscles are working here?
I said that the rotator muscles, which are located deep along the spine, and the scalene muscles, so there are quite a lot of muscles involved. It's not really worth singling out any one in particular, because the trapezius works here, and many others. Is this more of a stretch, right? No, it's more of a warm-up activation exercise.
Can't help but ask about posture. Among others, I have women watching me, and I talk to my wife. She constantly asks how to get a beautiful posture so I don't slouch, so it looks, I don't know, like something. Like Princess Diana from the side. Are there any recommendations?
Listen, well, again, you need to start with a definition. Now I'm going to sound like one of those boring lecturers. Go ahead. So posture? You need to understand that posture is a habitual, automatic, instinctive position of the body as an adaptation to vertical load. In other words, it's like our body is a Jenga tower, like that toy, where you stack blocks on a table. It's about how it adapts so it doesn't fall over. And that's what our posture is? The idea that, for example, certain curves in the spine affect something is actually a rather debatable point and needs to be studied thoroughly. For instance, hyperlordosis is when our lower back arches forward. It's not a given that this causes pain. In fact, there is evidence that, on the contrary, a flattened lordosis causes even more pain. If we look at biomechanical models, if our spine were simply straight, just a straight vertebral column, it would absorb 16 times less load than a spine with curves, because the curves are needed for shock absorption, again, to support this postural function, that is, the function of posture. If we talk about how much posture can actually be corrected, I'll be honest. Here, the question is
Aesthetics, for example.
aesthetics, a rounded,
Back. A very pronounced, for example, lumbar curve or the absence of one. A person wants to correct this and look visually attractive, according to generally accepted standards. The question, would it be harmful if someone strives for this, or on the contrary, is it actually good?
What is definitely harmful is if you try to sit like this all day. That is, you sit in a supposedly perfect straight posture and try to maintain it. Several patients have come in specifically with pain, with flare-ups after this kind of self-correction. Why? Because you're putting a load on these muscles, the stabilizers, the extensors. It's static, again, static. Why do you need that? Just sit however is comfortable for you and then train your muscles. If we talk about how realistic it is to correct this, again, for most people, because when it comes to pain or degenerative changes, posture doesn't play a major role. It's quite difficult to do after the age of 25. Why? Because we have what's called osteogenesis. That's how our bones grow, starting from the first years of our life and usually finishing by the age of 25. Osteogenesis ends for us. And when the growth plates of the bones are closed, it's quite hard to correct anything. So if we set aside all the marketing, even though everyone keeps saying that posture can be easily fixed, posture can actually be corrected if we're talking about the relaxed type of posture. There are different types of posture. For example, a rounded posture, which means we have an increased kyphosis, to put it simply. For example, we might have a flat posture where the thoracic spine is flat, basically a flat back in the chest area, and at the same time there's a hyperlordosis in the lower back. But most often, what we see is the relaxed type of posture. That is, it's a kind of functional change where a person doesn't have muscle tone. This can be solved easily with physical exercise. If a person hasn't done physical exercise and then starts, their posture can change immediately after one session. Why is that? Because the muscles have been activated, motor control has appeared, motor skills have developed, and the person becomes aware of their muscles. The muscles then start to support the muscular corset, beginning to function in supporting the back. Therefore, if we want to work on correcting posture, our first priority should be to eliminate physical inactivity, not just for the sake of it, but to address the lack of physical load and to strengthen the muscles.
The three biggest common myths about back pain.
The first and most important myth is that back pain always means there is some kind of mechanical damage in the back, like a hernia, protrusion, osteochondrosis, scoliosis, or lordosis. Once it was a very beautiful dog city. The second myth is that our back usually hurts because of our posture. We've already discussed that posture isn't as important as the variability of your position, tension, stress, and so on. And the third myth about the back is probably that you absolutely have to treat it with swimming, or with some kind of single exercise, that isn't individually tailored to the person. As I say, swimming can help us relieve back pain, but for some people, swimming will actually be contraindicated. For others, on the contrary, swimming will work well because they enjoy it. But overall, this recommendation to go swimming comes from Soviet-era neurology because our orthopedists and neurologists, just general practitioners, like to treat any kind of back pain with swimming and so on. So this is definitely a myth. Still, the current approach in modern medicine, evidence-based physiotherapy, and rehabilitation is that you need to look for more specific types of exercise, not just swimming or splashing around in the water.
But I think that's actually a rather non-specific type of exercise for us. That is, we don't feel our weight, our body mass. We aren't standing on our feet.
That's absolutely true. After all, we stopped being aquatic fish a very long time ago. Fish, yes, or amphibians, so we really do need to provide some axial and strength load. Aerobic exercise is also very important, by the way. Training the heart, including running, walking more often, and dancing. That's important too. The heart is a muscle too. A lot of people forget about that. Everyone needs to train and strengthen their heart muscle because, according to some statistics, unfortunately, we have a lot of deaths from heart attacks and strokes. We've already touched on this a little bit. Still, people think you can cure back pain with a pill or some substance introduced from the outside. This might provide some temporary relief, but what do people usually use most often? Painkillers, pills, things like ibuprofen, arcoxia, and so on. People use muscle relaxants, some kind of analgesics like paracetamol. Still, as I said, our back is meant for maintenance. Maintenance in the form of walking. When we walk, the spine gets nourished. If not, it doesn't. This is an obvious and fundamental, but for some reason many people, and unfortunately many doctors, forget it. An interesting
thought. Pain is a signal. Pain is a signal.
Of course, yes, because as I said, if we turn off the brain, we don't feel pain. A very simple and logical example.
Yes, but considering this experience, is it really truly actually true that a sedentary job is more harmful than smoking?
Listen, whether it's more harmful or not, those kinds of categories are pretty debatable, but I would say it's the new smoking. There's a trend to call a sedentary lifestyle the new smoking. And that's partly true. Why? Because if we look at history, at first smoking wasn't considered as big of a problem as we know it to be now. Many people even advertise smoking as, on the contrary, a way to improve health, a way to relieve stress. And even now, many people think that smoking is a good way to relieve stress. By the way, that's not true. Smoking is, let's say, not the healthiest thing, including for the brain. Nicotine, after all, is harmful in large doses. A sedentary lifestyle is the same concept. Over time, we come to understand just how much it harms our bodies. And we're not just talking about the spine. We'll be discussing the back, joints, muscles, neck pain, and so on today. We're basically talking about all the systems. Why does this happen? We are upright creatures. We shouldn't forget that we've adapted to walking upright over tens and tens of generations, thousands of years, and so on. But what exactly happened just 2 short centuries ago? We suddenly started to... For thousands of years, we adapted to upright walking, and then 200 years ago we sat down on chairs at computers, machines, and so on. And these 200 years in terms of evolution are basically nothing. We haven't had time to adapt biomechanically, neuromotor-wise, neurophysiologically. We're still the same hunter-gatherers who are supposed to walk for 8 to 10 hours a day and actively use all our muscles. And of course, when we don't do this, all our bodily systems become suppressed from the body itself to the brain. Depressive disorders are directly linked to prolonged sitting. Joint diseases are directly linked to prolonged sitting. Muscle diseases, officially pain syndromes, are also linked. By the way, this also concerns the pelvis in men. Yes, the male reproductive system. All of this suffers greatly from hypodynamia, from a lack of movement, first and foremost. So yes, you could say that sitting is the new smoking, and it's not even clear which is worse, sitting or smoking.
I know for sure that walking is like our second heart, helping to pump blood throughout the entire system. It's true. Plus, I know that there's a molecule that transports DNA, and it seems to stop moving as effectively if there's no physical activity, right? Just like basically everything else.
In our body. So movement
is life. That statement is kind of... And I
don't know, of course. We live in such an era now of decadence, of cosmodernity, and phrases like movement is life already seem, well, not so mainstream anymore.
Basic.
Yeah, it's not as basic as it actually is. And by the way, speaking of Instagram, I often try to promote there a truly significant movement that started about 10 years ago in the Western internet called movement optimism. And its message is that there are no harmful movements, that movement is always beneficial, always better than sitting or lacking movement. Moreover, movement can even heal. We're going to talk a lot about that today, about healing bad backs, and we'll even demonstrate, so stay tuned and watch until the end. I think this is one of the most useful podcasts you can watch, even if it's not directly related to your professional field, because it concerns each and every one of you. Yes, Dent has prepared
a set of exercises, and today we'll show you which exercises you do.
Including, I won't definitively say that these specific routines will absolutely help you, but you'll certainly get the general idea, and most importantly, you'll fully understand the fundamental concept of how to at least effectively avoid letting yourself go by the time you're 40 years old, so that at 30, you meet me not in my professional office, but rather at the beautiful beach, in the majestic mountains, actively playing sports, and so on and so forth.
Dan, is it truly accurate that our lower back gets the most strain when we are sitting?
Yes, that's right. In general, our lower back is always under strain and gets the most load. For example, the L5S1 segment is the record holder for the number of herniated discs.
What can help?
How to help your lower back? Move, keep moving, and also strengthen your lower back. Well,
It's not about stretching, it's more about strength exercises.
you can do stretching, but you absolutely can't do without strength exercises.
How?
As I said, this muscle corset is only necessary so that we experience less pain, to put it simply, for proper posture, but mainly so we can maintain all the large muscles that go through the lower back. By the way, we can pull up some vivid MRI examples. I always look at MRIs and pay attention to the muscles. You can see these black circles there. You might look at the psoas, maybe the quadratus lumborum, the gluteal muscles, and so on. And you can immediately tell an athlete from an IT specialist, because athletes have large muscles without those white layers of fat. Usually no fat, just big muscles. You sit there envying them, thinking, wow, good for you, that's how it should be. But an IT specialist will have small, shriveled, oddly shaped things, lots of fat, little muscle, and so on. By the way, there's also a common myth that people with a thinner build have back pain more often. I would say that's absolutely not true.
In fact,
People with a thinner build actually have more degenerative changes in the spine. They have more herniated discs, more misalignments, and so on. Because quite often,
the load, but they too don't exercise.
they haven't been exercising since childhood, and their bodies adapt in such a way that everything ends up crooked and misaligned, but they don't feel any pain. So, our pain is biopsychosocial, not mechanical. Then, what's a non-obvious factor that affects back pain? Listen, a non-obvious thing, well, it's probably the psyche, but people also underestimate how much stress affects our back pain. At the same time, it's important to understand that emotional experiences, depressive disorders, anxiety, they all have an impact everything, the whole body, starting with the cardiovascular system and with the muscles. For example, when we're stressed, our muscles start to spasm reflexively, and that's why we feel tension. Even after the stress has passed, this tension can kind of linger in our body. Now, I'm not comparing this to theories like Wilhelm Reich's, that emotions live in our body, but the fact remains, when someone is tense, their muscles spasm.
Psychosomatics?
This could really be called psychosomatics. Nowadays, everyone likes to blame any illness on psychosomatics. For example, your knees hurt because you don't love your wife, or your shoulder hurts because, I don't know, you have low self-esteem. I think these are still some kind of esoteric things, but stress really can affect back pain. And some doctors, for example, prescribe antidepressants for back pain. This is a fairly well-studied phenomenon because, as I mentioned earlier, pain is always an interpretation of sensations from the body and the brain. I recall that if we administer anesthesia, essentially putting the brain to sleep, we don't feel any pain at all, even though our tissues are still being cut. Everything is bleeding and so on. In other words, if we switch our focus, we can actually forget about this pain, even if it's chronic pain, or sometimes even if it's acute, if it's caused by some pathology.
If a person is heavy, say weighs more than 110 kilograms, do they need to lose weight, and does this affect the health of the spine?
Of course, it has a very significant impact. And here, the key factor is, what kind of mechanical load can directly and consistently affect the tissues?
And
By the way, it's worth noting that not all people with excess weight complain about back pain. Even those with end-stage obesity don't always experience lower back pain and so on, because the body adapts to it as well. However, degenerative changes still occur. Their lumbar lordosis increases significantly, which is always directly related to excess weight, and all the tissues, vertebrae, discs, ligaments, and so on, wear out much more. So, losing weight is definitely necessary. Nutrition affects the spine just like it does all other systems. As for recommendations, I only advise making sure you get enough protein. If we don't get enough protein, by the way, there aren't really any studies on this, but it's clear that protein is a building block. Without protein, everything in our body will regenerate and recover much worse.
I'm going to grill you about sleep now because it's actually an important topic and a lot of people have issues with it. I'll ask you questions and you can answer briefly. About pillows, can you use any pillow, or is there a specific list of pillows that are recommended here?
With pillows, the most important thing is that our neck is supported on the pillow.
Often,
Problems often arise. Sometimes I work with tension headaches, which are the most common type of headache. They can be caused by tension in the neck muscles. Let's not get into all the details. I've noticed that if we carefully adjust their pillow, for example, I often ask them how they typically sleep and whether they experience any significant pain after sleeping. Sometimes we try placing a small towel right under their head to make sure there's no uncomfortable gap between the neck and the sleeping surface. In other words, it's really important that the neck is properly supported by something. If we ourselves happen to fall asleep and our neck is bent like that, I really don't think that's the best idea at all.
so,
Just make sure that our entire head is resting on something.
well, it could potentially be a soft down pillow or a firm foam pillow.
At this point, it's really just a matter of personal preference. For example, I sleep on a firm pillow, my friends sleep on soft ones, feather pillows, orthopedic ones. According to research, there's no difference at all.
Next, what about the mattress? Should it be soft or firm?
Medium firmness. Again, according to research, a medium firm mattress is actually the best for maintaining the shape of the spine so that the major muscles don't get overstrained and can relax properly.
But what does medium firmness mean for people of different weights? Some weigh 110 kilograms, others 60 kilograms. So when we lie down, what should we feel?
Well, we definitely shouldn't sink too deeply into the mattress. There should be a firm support beneath us, but at the same time, it shouldn't feel like we're lying on a board. So, medium firmness is actually a pretty subjective concept. Honestly, I myself don't really know. I haven't delved into what the authors mean by it, but just try to make sure it's not too soft and not too hard. And
The last thing is oxygen. There should be a constant flow of fresh air. Yes, just about that.
The room, a window, not an air conditioner, although an air conditioner also circulates air in the room.
just simply crack open a window. It's a really truly great and beneficial thing to do.
A question from me, a popular topic, a standing desk, a treadmill, and a person walks while working. Does this actually work or not? It's great, I myself.
Have worked like that, absolutely, but I probably can't afford a treadmill, and honestly, I'm not that glued to the computer.
So, give a thumbs up, you recommend it?
I would recommend it, yes, but it's important to understand that you shouldn't go to extremes because there's a problem with both a sedentary lifestyle and standing all the time. For example, if we stand a lot, we can develop varicose veins, vein enlargement, varicose veins. That's why, for example, bartenders, makeup artists, and hairdressers come to me with leg pain, varicose veins, and so on. So you shouldn't stay in one position for too long. You just need to change your posture as often as possible. Lie down, stand up, but overall, standing is still better for your spine than sitting.
Are there any scientific studies or approaches that say, here is a chair that is worth buying and this is the kind of chair a person should sit in? For example, are there places like a stool that you definitely shouldn't sit on because you'll end up with back problems?
Listen, I take the opposite view. I believe that the more uncomfortable your chair is, the better. Why? Because this is a very important point. There's a really good illustrative study where people sat in both correct and incorrect postures, basically like this and like that. You know, there's that picture, green check mark, red cross, like your eyes should be at a 90-degree angle to the monitor, elbows on the armrest, and so on. And it turned out that everyone ended up with back pain after a while. Again, it's not the posture that matters, but the static position. Ergonomics can make some difference, but it won't be as significant as the impact from simply not moving. So if we try to fix our back just by getting a comfortable chair, and if it's so comfortable that we stop moving altogether, well, think about what a typical modern person's day looks like. They go to work, commute to work, so they're already sitting, whether it's in a car, on a bus, or in the subway. Then they sit at a computer for 8 hours, then go home, turn on Netflix, and sit for another 8 hours watching Netflix, or maybe at the computer at home. Or they spend 8 hours scrolling through TikTok Reels and so on. In other words, there's no movement at all. We simply don't have time to take care of our spine, we don't let our muscles move, we don't let our joints get lubricated, and we don't let our tendons do their job. So, if we try to make up for this simply by sitting in a supposedly ergonomic chair, that's actually a huge self-deception. It's truly important to understand what the conclusion of this particular study was, because interpretation matters too. Your very best posture is your next posture. I have only one recommendation for people who want to somehow optimize their sitting. Try to spend as little time as possible sitting in the same position. So, if you sit like this for 12 minutes, that's fine, but then, for example, you might shift, maybe lean onto your right hip, or you can stand up or lie on your stomach, on your back, or on the floor. I constantly
Have this happen to me at the office. I used to think I was sitting incorrectly because I lean back, I sit up straight, I shift to my left hip, to my right, It's okay.
That's actually great.
Please name just one specific device that can effectively help a person with a sedentary job.
Well, as a device, I think you could use a fitness tracker or an alarm clock. I said that if we try to change our posture more often, this can be managed with reminders. Another device you could use, well, I don't know, maybe some kind of massage equipment. Self-massage, massages and so on. These could be massage rollers, massage balls. It's important to understand that they simply work as a way to relax. These can also include Soviet-era Kuznetsov applicators or acupressure mats. Basically, anything that helps us relieve the accumulated tension in our muscles. Let's say we spent 8 hours at the computer, then rolled our neck a bit on a roller. It's like a massage, but more on the surface, probably not as effective. But you can still work out your muscles with percussion massagers, or some people even buy electric muscle stimulators, whatever works for you. The most important thing is that we experience some relief, not just constant strain throughout the day.
So if it feels good, then it...
If it feels good, you can do it. No one can forbid you.
Well, I guess, as in the previous question, a big factor here is psychological. Of course. It's important that a person isn't under stress 24/7.
This in principle is the most important thing, not just in the context of back health, but in life in general. So, look, what a beautiful one is running. Do you think it'll get away over there?
I don't know. There are percussive massagers. There are also massagers like electric ones. For example, a foot massager, a back massager. That's a useful thing.
Listen, it's actually a good topic. I myself own such massagers, not just for work, but for personal use as well. I'll say this, I use all of them very rarely. And people who buy them also, over time, it's like what happens with exercise equipment. That is, the exercise machine turns into a clothes hanger, and the vibropercussion massager very often just becomes a decorative item. Because, well, it does have some effect. That is, it's vibration they can tap and, in a sense, improve circulation a bit under the muscles, under the skin, and so on. And relax the muscle, reduce excess tone, and stimulate the nervous system. But still, the difference between a massage therapist and a massager is that a massage therapist works not just with their hands, but primarily with their head. If the massage therapist is competent, they will do you much more good than a massager ever could. But if not everyone, even among massage therapists, knows how to use radiofrequency devices. That is, some people start running it over their neck, under the occiput, over the bones, or even over their elbows and so on. Well, you really shouldn't do that, because after all, it's not worth irritating sensitive structures. So it's a good thing. But you have to understand how much you actually need it and how much you'll really use it. So, I don't know to what extent it will pay off its supposed benefits.
There are gravity boots where you hang upside down or you just hang from a pull-up bar by your legs, and they say this supposedly decompresses the spinal discs. Is this useful? Should you do it?
Listen, decompression and all these spinal traction techniques are quite an interesting topic. I'll put it this way. For some people, this is strictly contraindicated, especially if you already have acute back pain. The last thing you should do is stretch it on some kind of equipment or even on a pull-up bar. None of that is recommended.
Why is that exactly?
It's quite a big misconception. You might get a kind of subjective relief in the moment. That is, you might feel a bit better, but then it could actually get worse. Why? Because you don't really know what's going on with your spinal canal, or, for example, with your spinal cord, there's a risk of compressing nerve roots. Back pain can be caused by many different things, and not everything can be treated by stretching. That's why we first try to figure out why the back hurts, and only then consider stretching it. Sorry, about stretching. If it's just to relieve some tension in your back, yes, that can work. Well, in principle, it's not forbidden.
But
I would still focus more on active movement, on some strength training exercises.
and if we rely on the theory of evolution, before this we were monkeys jumping from branch to branch, so it turns out that this is kind of a natural, familiar position for us, for our backs.
Well, possibly, yes, you could absolutely say that.
But still, for example, when a person is over 25, say 30, we can clearly see that they have spasms in their chest muscles because they're constantly working them out. And at some point, what do they start doing? They start stretching their chest muscles and working out their traps, hoping that their slouching will go away. Will this help, or is it useless? Here.
The experts would say that everything is individual, but here's an interesting point about stretching. You mentioned, if I'm not mistaken, that stretching improves posture. There have been some pretty large studies. This is just like a day for myth busting, right? Like on that show on Discovery Channel. And they compared how stretching exercises and strength exercises, let's say, for stabilization, affect posture. It turned out that stretching doesn't improve posture much, while strength exercises are more effective. Therefore, if we're talking about improving posture, stretching should probably be put on the back burner. In general, stretching is something that's really overrated. People think that flexibility always means a healthy spine. For example, when I was at the gym and people said their backs really hurt, they were simply told to just stretch. It's like, you're still quite young, you truly need to work on your overall flexibility, do various yoga poses and so on, such as cat-cow stretches. But actually, stretching doesn't even really stretch the muscle that much. So when we can't do the splits and then later we can, our muscles are actually the same shape.
I thought it was because of stretching.
It's not so much about stretching itself, but rather your nervous system's tolerance to stretching increases.
So,
Let's put it this way, a lock, and when unlocked by the nervous system, we are more flexible.
does that mean anyone can do the splits? It's a mental block.
Not exactly anyone can do it, because everyone has different joint structures, hip necks, and so on. But the point is, if you and I managed to do the splits when we couldn't before, it's most likely not because our muscles stretched, but because our nervous system started working a bit more cleverly and was able to adapt to the splits. Yes.
But I have a story about that. I went to kickboxing and the coach said, let's stretch.
And
We all did the splits as far as we could. He came up to me and hit my leg. I stretched properly and it hurt. And actually, the problem wasn't here. I was limping for about a week. So what exactly happened there?
no, the ligaments, just like everything else, they adapt during kickboxing. But the point is, the fact is they don't stretch in the way people usually think. I mean, it's not like, oh, I have a muscle, and after a year of trying to stretch, it suddenly becomes like this. So what?
What was hurting then?
It was hurting again. It was more like a block from the nervous system, preventing you from stretching.
We disrupted it. There was a spot reaction.
Yeah, something like that.
How do you avoid getting a serious hernia at the gym?
Well, in principle, we shouldn't be fixated on not getting a hernia at the gym, because most likely, if you've started going to the gym, you already have a hernia. They say everyone over 25 has a hernia, and most of the time, they don't cause any symptoms. We just need to understand that it's very important to follow one key thing, adaptation, which is also called progressive overload. For example, if we come to the gym and start lifting a barbell 120 times, we'll get injured, be out for a long time, and will only be recovering. If we start with just the empty bar, then add 20 kilos, then after 2 weeks 40, then after another 2 weeks 60, and so on, we will gradually ease into our physical activity. All our muscles, tendons, ligaments, and so on will adapt and gradually promote muscle growth. That's why the most important thing is to start small and gradually progress. Also, I probably wouldn't recommend chasing after some big achievements if we're not athletes, right? Because we often look at people on Instagram, at those bodybuilders lifting heavy weights, and you have to understand that many of them are using certain pharmacological substances, many of them practically live in the gym, but if you're just regular IT folks who want to work out for back health or, I don't know, for general well-being, then a few strength training sessions a week with a sensible approach, maybe a training program from a coach and so on is more than enough. I would probably still recommend getting a coach because a coach can help you gain some basic knowledge about anatomy, physiology, maybe give you some advice on nutrition, and also help you avoid injuries. Although, honestly, the risk of getting injured in the gym is not as high as the risk of getting injured from prolonged sitting. After all, movement is always better than no movement at all, you know?
All my life, I believed that, for example, when you do deadlifts, your back should be straight. But I saw a study that says it doesn't matter what your posture is. Do it in the way that's comfortable for you. And it turns out this doesn't affect hernias or protrusions in any way.
That's a very interesting fact. We've discussed this research and we've argued a lot with different doctors online, by the way, including Anton and Pifan, even such a well-known doctor. Many of my colleagues were on my side, some were on the other side, and so on. There was a major debate about how safe it is to lift heavy weights with a rounded back. We'll show what that looks like. And it turned out that, for example, when we do a press, that is, when our lower back is actually arched, the back is still rounded.
In other words,
They actually inserted special rods into the spine and observed how much the angle changes. We never have a truly neutral spine. We always lift weights with a rounded back. But the position of the spine itself doesn't play any role in whether our back will hurt or not. What matters is how often we've done deadlifts.
if
If we've been doing deadlifts for many years, then lifting a normal weight for ourselves won't make our back hurt. If we just come in and immediately lift something heavy, of course our back will hurt, because there's no adaptation of the muscles, tendons, ligaments, and so on. That's why, yes, form and certain mechanical aspects play less and less of a role. Biomechanics, of course, is important in some ways, but it's definitely not the final word.
degenerative changes in the vertebrae are probably also important. That is, if there's no nourishment, like you said, if you don't walk and the pump doesn't work, then it will definitely deteriorate no matter what kind of load you put on it.
Yeah, absolutely, that is quite true.
In the next scenes, we'll show you exactly which exercises you should do visually. Let's list them like this. Must-have exercises for the back, and really, for overall well-being, so that you don't have pain in any part of your body.
Let's watch. A very important point is that we need to train what is the least trained in us and stretch what gets stretched the least during the day. If we're talking about IT specialists, a person sits in this position all day, right, for about 8 hours. What do we see? We see flexion of the cervical spine, flexion of the thoracic spine, and a complete lack of movement in the glutes. That's why it's important for us to train neck extension. This could be a specific exercise, as well as exercises for the thoracic spine. Extension of the thoracic spine. We need to train our arms because they just lie there limp like sausages, only moving the mouse. We need to train our lower back, our flexion and extension, and our glute muscles, for example, by doing squats. In other words, it's important for us to give our bodies the kind of load that we don't get during the day. And if we talk about what exercises are needed, it's those that are associated with our daily life. That is, we need to train bending movements. For example, we bend to the side. Yes, there are side bends. We flex, we extend, and all these movements should be well trained for us. For example, if we lift a 50-kilo barbell from the floor, the risk that will hurt our back when we bend over to pick up something by the handles is much lower, because our muscles are already prepared for a heavier load. Next, we can do some exercises for the thoracic spine. For example, the most well-known one is the so-called cat-cow exercise. So, what do? We get down on all fours and then start by gently rounding our upper thoracic spine as much as absolutely possible. That is, let's say, as if we're inhaling air and arching our thoracic spine as much as possible. We should lower ourselves below our shoulder blades, and we make this kind of movement. We bend and extend as much as possible. Extend round. This
Exercise, what part of the body is it most beneficial for?
This targets the thoracic spine more. It helps restore the very mobility in your back that you might be lacking. It's absolutely excellent. It's very important to fully understand that all exercises are individual and unique to you. If you ever feel any pain during the movement, it's always better not to do it at all. And of course, if you have any contraindications, it's best to choose exercises that suit you. Because what we're showing is just a demonstration, introductory material, so you can repeat it if you decide to do it regularly. Next, we can also do some exercises that will help us train our shoulder blades. Because we tend to sit like this, and our rhomboid muscles don't get any load. For the shoulder blades, we lie down on our stomachs and show a thumbs up. And let's adjust you. Your task is to feel the tension between your shoulder blades and bring their inner edges as close together as possible. At the same time, your arms shouldn't go back. Your arms should move strictly in a straight line. Lift your thumb up and gently lower it down with control. Now slowly lift your thumb up towards the ceiling. Carefully bring your shoulder blades together and then smoothly lower it down again. Lift, then lower, maintaining a consistent and steady rhythm throughout the exercise. Vlad is doing it very well. He adjusts the exercise using his inhale and exhale. On the inhale, he lifts up with his shoulder blades, engaging the rhomboid muscle, and on the exhale, he lowers back down. Here we have a guy in the gym who's not exactly small. Tell me, how does it feel to you?
I can feel it. You can feel the muscle, right? You can feel the barbell you're doing bent over rows. Even with 60 kilos, I don't feel it. Yeah.
Because some specific muscles really need to be properly trained, and the small, often overlooked stabilizers are very weak, even for such simple everyday movements. Yes, indeed.
Can I add something myself?
Of course.
I found that to loosen up my lower back, even on a plane when I'm flying, I do this. I lower the tray table and lean over it like this, and it actually makes me feel better.
That's a classic stretch for the lower back. You can definitely do that. Personally, I prefer a slightly different version using a chair. Let me bring it over and you can try it. Look, you do it like this. You stand as if you're in a prayer position.
Bend over.
Like this. And your goal is to just bend down so that you're actually very much lower than your elbows are. So that you can knock.
Go ahead.
Just a knock.
I'm holding it, don't worry.
So you really arch your back in this position and curve your spine. You can repeat the same thing, and you'll feel a great stretch not only in your thoracic spine, but also in your shoulders and even your lower back.
Yes, please hold it too.
Let's do the prayer position. Lift your body up again and gently stretch down under your shoulder blades, then slowly lower yourself back down.
Try to do it as you exhale to help you relax.
Yes, that's important. Regulate your inhale, exhale, or the movement itself. We can keep doing this together if you want. These are classic movements everyone knows, but no one does them or they do them incorrectly. The classic boat pose. It was taken from hyperextension exercises, but the boat pose is safer and the movement is straightforward.
Then I'll take off the microphone and show it.
Yes. Lie down on your stomach now. Let's do the version that I like more. Stretch your arms upward. Bring your palms together. Turn your palms inward. Just like that. Perfect. Lower yourself down completely, relax, and exhale. As you inhale, you'll lift both legs at the same time. Raise both arms upward at the same time. Try to keep your arms and legs roughly in one line. So you don't need to lift your legs too high or your arms too low. Keep them more or less in the same plane. And lower yourself as you exhale. The goal is to make the movement a bit more challenging. If it's already difficult for you, just try to hold the pose at the top for a few seconds. For example, I'm doing the exercise. 1, 2, 3, 4, 5, relax. This isn't an easy thing for you here either. Here the muscles being trained are the back extensors, which, let me show you, can do this. I'm lifting up now. See, these little cords have appeared on my back. These are the red muscles, the back extensors. Lower yourself down, then lift up. That's exactly what we're training here. Exactly.
I also like to do rocking exercises at home, you know?
Yeah, that's actually not bad either. But you see here, the extension is performed in a single function. You can do it like this, it's not bad. A pretty good option.
Listen, for example, what if someone doesn't like going to the gym? Are there any specific types of sports or physical activities you can do to get the same positive effect?
Absolutely. Basically, as I said, the WHO recommends 2 strength training sessions per week. We can train our muscles through boxing, tennis at home, or even in some kind of yoga with strength elements and so on. Even swimming. But the most important thing is that the exercise is there, that it matches our physical condition, and that it suits us psychologically. It's very important that we actually enjoy doing it. Because, when an IT specialist comes to me at the very beginning of their journey, they basically don't do anything at all. They just code at the computer. And I realize that it's my mission to enlighten them and somehow introduce them to physical activity. Because everyone needs to exercise. If you think that some people can get away without doing sports, you're really fooling yourself again. That's why it's important to gently and carefully find a type of sport that you enjoy, and ideally, one that becomes your hobby. Because if we do it out of desire, not just because we have to, we'll make progress for much longer on the long run.
Progress continues.
And it's progress not just physically, but psychologically as well. We'll make friends, acquaintances, and find a community. That's why it's really great when we enjoy what we're doing. And look not for what's supposedly the most beneficial. The most beneficial sport is the one that brings you joy.
Enjoyable.
And as for just this,
What position should you sleep in?
in a very comfortable one. I have a rather short post that I recently wrote. I wrote an extensive article reviewing the latest research. What are the pros and cons of different sleeping positions? Basically, there are 3. On your side, on your back, and on your stomach. Also, people distinguish between sleeping on the right and left side. And yes, for example, pregnant women shouldn't sleep on their stomachs, which is pretty obvious. In the last 3 months, you shouldn't sleep on your back either because there's a lot of pressure.
It's better
to sleep on your side and so on. For example, for people with reflux, if there's a recommendation, this is a common one, the advice is to sleep on your side with your head elevated. But for healthy people, you can really sleep however you like. The main thing is that it's comfortable, yes. There's a myth that most restrictions are probably about sleeping on your stomach, because gastrointestinal problems can be aggravated by anything that increases unwanted pressure and so on. It might also affect your posture, because again, it's hard to find a position on your stomach where your neck isn't overextended. As they say, it's not the healthiest thing. So, sleep, however, is comfortable because we forget that our bodies move around during sleep. The mechanism of our nervous system isn't stupid. It makes us turn over so we don't end up with numb limbs or nerve damage. This, for example, frequently happens to people who drink very heavily, like homeless individuals sleeping on park benches. Because severe alcohol intoxication profoundly suppresses this vital signal, they can unfortunately end up lying on their arm for such a long period that its function becomes permanently impaired. So unless we are truly homeless and sleeping on a public bench, we can generally trust our brain in this crucial regard. The absolutely foolproof protection is built right into our very own skull. It works very well.
Please share some life hacks for people with back pain. Briefly, in bullet points.
I would start by saying that getting enough sleep is important. An important point is that our back is very closely connected to how we sleep. Let me say right away, there is no position that is definitely harmful temporarily, but if you sleep poorly, say for too few hours, in a bad environment, stuffy and so on, then all our regeneration processes will be impaired. Here's an experiment you can try. Usually a person is shorter before sleep than after sleep. For example, I might be 190 centimeters tall in the evening, but in the morning I'll be 192 centimeters. That's because as you walk around, again, it's a matter of disc hydration. Let's put it this way. Over the course of the day, we walk around a bit and the discs become less hydrated.
Gravity.
Yes, gravity. And this rehydration happens when we sleep. Accordingly, if we don't get enough sleep, the discs suffer, our back hurts, we get hernias and so on. That's why it's important to optimize your sleep. Sleep on a comfortable mattress and a comfortable pillow. It doesn't have to be orthopedic and the mattress doesn't have to be too firm. A medium firm mattress, a comfortable pillow, a cozy environment, dark, cool, and so on. Basically, that's enough.
Today I saw a study where Japanese scientists said you should sleep at a temperature of 21 degrees. If the temperature increases by 1 degree, sleep quality drops by about 20%.
Listen, is it possible that this is true? It seems that these metrics are subjective. What does 20% mean? Is it possible to change something objectively?
Was it a controlled study?
Yes, but still, yes. A cooler temperature truly does benefit us, and indeed helps with good sleep.
Dan, what should you do if you have back pain? Should you just go to see you, or do you need to get an MRI first?
Look, you don't necessarily need to get an MRI if you have back pain. Why? We can divide back pain into two categories. The first type is specific pain, the second is non-specific. Non-specific pain refers to musculoskeletal disorders, meaning those that result simply from our lifestyle, stress, and so on. These are not fractures, not herniated discs, not dislocations, just muscle overstrain, which is now called musculoskeletal pain. They generally don't need to be treated, they go away on their own within a few weeks. But if we do some physical exercises, get a massage, maybe apply heat and so on, it can feel better in the moment and perhaps the regeneration process will be smoother and more comfortable for us. The second type of pain is the one that definitely requires an MRI, definitely needs to be examined by a specialist and absolutely needs to be treated. Here you can immediately outline a sort of checklist. If your pain occurred after some kind of fall, that is, there was a mechanical factor, an impact, you tripped, that's an immediate red flag. If you experience pain for the first time before the age of 20 or after 60, that's also a red flag. Because before the age of 20, back pain is uncommon, and after 60, back pain usually has a specific underlying cause. If you have symptoms like a fever, sudden weight loss, or chills, this could indicate infectious diseases of the spine. It's also important to consider things like pain that occurs during sleep. If we can't fall asleep because of the pain, that is, the pain is so severe that it keeps us from sleeping, that's a red flag. If the pain is at a 10 out of 10 intensity, really sharp and strong, that's also a red flag. And these situations definitely require a doctor's examination first, and only then, if necessary, an MRI. Everything else, as I mentioned, is benign pain, and it can go away on its own, or it can be treated by a massage therapist, a trainer, a rehabilitation specialist, or also by doctors who know how to treat pain according to modern standards and protocols and so on. Because, well, every doctor treats back pain in their own way. It's true. Some refer patients for injections, immediately perform nerve blocks, some just prescribe ibuprofen, and some say it doesn't need to be treated at all, you know. After all, according to evidence-based medicine, it often resolves on its own, so you might not need to intervene at all. But that approach isn't very humane either, because yes, you could say, just endure it, it'll go away by itself. But a person is a living being, they need to work, they need to live somehow, and so on. That's why many people underestimate additional procedures like, I don't know, massage, self-massage, myofascial release.
When we're talking about hernias or protrusions, are these really benign or malignant?
In 99% of cases, it's a benign condition. Why? Because everyone has hernias. Hernias are a normal part of our spine structure. For example, you and I have wrinkles, or will have them someday, and hair, and eventually we'll get wrinkles in other parts of the body, not just on the face, and we won't treat that. Why? Because it's a normal phenomenon. It's the same with the spine. The spine is a resource. Our spine, so to speak, wasn't designed for such a long life as we actually live. Nowadays, we live on average about 70 years, but it's important to understand that these 70 years, as an interesting thought, we've reached this extended lifespan mainly thanks to advances in cardiology. That is, because we've become better at treating heart and vascular diseases, and also thanks to antibiotics and vaccines. We haven't made as much progress with all the other parts yet, so to speak, for example, the vertebrae. We still don't treat them as effectively, for instance, when it comes to infectious or bacterial diseases. That's why it's still much harder to go through life completely without back pain. In fact, if we look deeper, back pain is actually the most common pain in the world. It's more common than toothaches or headaches. The good thing is that it often doesn't cause disability. That's why a hernia only hurts if it's really serious. A very large hernia, right? You know? For example, if it compresses some nerve root. By the way, here we
Can indeed
show a model of how a hernia protrudes for the intervertebral disc. Clear. Where's the back?
look at the spine.
Yes, this is the back of the spine. This is the front of the spine, yes. I'm explaining it so everyone can understand. Here we have this yellow tube, that's the spinal canal and the nerves. When we get a hernia, this disc tears and the nucleus pulposus leaks out of it. It's like something just happened. It's, let's say, a kind of semi-gelatinous structure. Basically, it's pretty soft. In modern times, it catches us off guard. But at the moment when it protrudes, it can press on the nerve root, and this will cause us back pain.
But what is a nerve root? What is it even for?
The nerve root is needed to transmit signals from the brain through the spinal cord to the legs, arms, and so on. But the fact is, most often hernias cause pain not only in the back, but also in the leg. Often the pain goes even lower than the knee, that is, down to the foot.
Yes.
So only in such cases do hernias have a real clinical picture, and in those cases, they really need to be treated as hernias. Everything else, when a person comes in and their back just started hurting after 9 hours at the computer, most likely that's not a hernia. And you shouldn't think they're so unique. Most likely, your muscles are just tired and overstrained. Although nowadays, people try to diagnose themselves with all sorts of things, scoliosis, jaw issues, even using GPT among other things.
That's a bad idea.
A bad idea. After all, they're just neural networks. There was news that, for example, GPT scored higher than a doctor on a test in America. But as far as my experience with ChatGPT goes, let's just say it hasn't been the best.
But different models, like the depression one?
Yes, there is a depression model, but its performance isn't perfect either. For example, if you write, depression model, find me studies that show scoliosis always causes back pain. It will give you a whole list of such studies. And then, if you write, GPT, find me a list of studies that show scoliosis is not related to back pain. It will find you a similar list. That's precisely why it's important to understand that GPT is still not entirely perfect and it doesn't possess true clinical reasoning, the kind of nuanced thing people develop through rigorous training, comprehensive medical education, continuous self-learning, and invaluable hands-on practice. So for now, leave the function of diagnosis to specialists. Let GPT do other things, like creating art,
And so on and etc.
I've also noticed, for example, that some of my patients, those who've had back pain for a long time, when they go on vacation, their pain can go away. I'm not the only one who notices this. Many of my colleagues do too. It really does require a mental reset, a change of environment, a change of scenery, and the pain can disappear. That's why it's not always obvious, but I definitely singled out stress, psychosomatic factors, and so on. Working.
As a psychologist,
This is always very important. Even psychotherapy, cognitive behavioral therapy, is actually included in the clinical guidelines for chronic back pain in many countries. I also pointed out things like smoking. Many people underestimate the impact of smoking. How it
affects things.
Look, remember, I told you again about how everything comes down to the fact that our intervertebral disc is a watery structure. And smoking affects the hydration level of the disc. Research shows that people who regularly smoke have much more severe and chronic spinal problems and experience significantly more pain. And in general, their pain threshold frequently fluctuates. So if you continue to smoke, I really don't understand why you do it at all and why you haven't yet quit smoking. Here's another reason why you should quit, because your back also suffers from smoking and from nicotine consumption, most of the smoke. The mechanism, let's say, of the gate control of pain, the pain decreases.
Is this muscle pain, or are we affecting nerve roots?
No, we're not affecting the nerve roots there, we're affecting all the nerve receptors under the skin, baroreceptors, thermoreceptors, and so on, though thermoreceptors are not involved. We're not training, we're relaxing the muscles that are under the roller by applying pressure to them. There's actually a name for this method. So we apply a bit of pressure and the muscles relax. It's a simple mechanism of the nervous system adapting to the pressure that's being applied right now. In the same way, we can use this roller on any part of our body. We can roll it under the thigh. That's something they do in fitness nowadays, right? One
Thigh.
thigh, or we can do both. Basically, the most important thing is that it makes us feel a bit of relief to feel that release. Originally, the people who came up with this myofascial release, and many of their followers, think that we're stretching some fascia here, or stretching some muscle, but that's actually not the case. If we look at the research, to stretch, for example, the iliotibial band, we would need a pressure of 900 kilograms at a single point. In other words, it would take two world-class weightlifters pressing on that spot at the same time. What we're actually doing is simply relaxing our muscles reflexively, relieving them from spasms, tension, and so on that we might have. We can also use a belt for support and do this in a static position. For example, you can comfortably lie down and even leisurely scroll through your phone to create a beneficial extension in the cervical spine after a period of prolonged flexion. So, as a very useful tool, which you were indeed asking about, you can certainly use it. And basically, there are no, yes, indeed, this is quite effective.
Feels good.
Yes. There really aren't any particular contraindications for this.
All right, for an exercise from the host.
About
The gluteal muscle. So we're sitting, and I know that two things get tight, the gluteal muscle, and what do you think about this kind of stretch?
here again, we're trying to stretch our glute. For example, why does stretching not work by simply lengthening the muscle? Here's your gluteal muscle.
Here,
It's located here, and it's already stretched, let's say, by about 20%. So this
is what's stretched.
Yes. If we want to stretch the muscle significantly, we need to go past this barrier. And here, for you, that barrier is your abdomen. So when it comes to stretching the gluteal muscle, our abdomen will get in the way. It's the same with many other muscles. In other words, we simply can't stretch all of them in our body. But for example, you can easily even tear something like the hamstring or the muscle behind the knee, what's located there. So that's why many stretches actually lack even the physiological sense that people attribute to them. Therefore, if we feel comfortable and relaxed while stretching, we do it. It's not like we thought our muscle was, say, this long, then became that long, and with stretching, it should go back to being this long again. Physiologically, it actually works a bit differently through the neural system.
Well, for me, the second exercise, there's one left. It's for the iliopsoas muscle, right here.
That is,
A forward lunge. And we do a stretch like this, so it stretches here.
again, we can do some kind of stretch like this, the so-called pigeon pose, for example, to stretch the glute. We can do things like this. We do all sorts of stuff like that. Yes, that is
Like,
these kinds of things. Basically, if you like it, you can do it. If you don't like it, you can just skip it and forget about it, because stretching as such doesn't play a significant role for us in this context. The most important thing is the strength foundation.
and don't worry.
Yes, so we keep an eye on the dumbbells, resistance bands, barbells, and so on. So the rest of this is entirely optional, let's say an extra bonus feature,
Well, that's it.
something like that.
Done.
Yes,
Is it true that most IT people have back pain and come to you for help? So, besides sports and physical activity, what else should be taken into account? It could be nutrition, the mattress you use, right?
look, yes, people often come to me and ask for some recommendations. I always share, I'm not stingy, so you can write this down. The most important thing, where we start, of course, is to add more movement. If we don't add movement, nothing else will help us, because neither an orthopedic mattress, nor a special chair, nor a standing desk, hypodynamia, meaning a lack of movement, is our main enemy. That's why we try to stretch as much as possible, try to walk more. By the way, walking is an incredibly important thing in our lives. Many people underestimate it, and many are surprised, as has been said, that in order for your back to recover, you need to increase the amount of walking you do. For example, let's take the intervertebral disc. It is nourished only through walking. We have, for instance, a structure between the vertebrae. By the way, you can show it. I'm a bit embarrassed by the red shelves. They filmed the red mattress. Here is your intervertebral disc, or more precisely, your spine. Two vertebral bodies are bony structures, and there is a kind of spongy, shock-absorbing tissue. It serves to nourish the vertebral bodies. As you can see, there are no capillaries or any vessels going into these bones. That's why they are nourished like a sponge. That is, there are pores here in a very general sense. And when we walk, these are nourished
Capacity works like
like a pump, yes. It acts as a kind of training function. And this happens best when we walk. So, for people in whom we see dehydration on an MRI, that is, a decrease in fluid in this disc, the first recommendation is to walk more often. Not to mention that walking is simply the very best biohacking tool you can truly imagine, because walking significantly reduces the likelihood of depression, markedly improves cognitive function, and many other benefits. At the very least, this is essential basic maintenance for all of these vital systems inside our bodies and minds. That's why we all start with walking first. Then we add some exercises. Why? Because we can easily go to the official WHO website and clearly see two important recommendations listed there. The first is about aerobic activity. We should walk at least 150-300 minutes per week doing aerobic exercise. That is, we should either walk, run, swim, dance, basically move our legs so that the heart pumps blood and everything in our body works better. And the second recommendation is 2 strength training sessions per week. That's it. There are no other recommendations. These are the systemic requirements for your back.
Not just for it.
For the back,
We have touched on the topic of nutrition, but now there are also supplements.
if
If there are any supplements that are worth taking for a healthy spine and the muscles around it,
look, there definitely are such supplements on the market, but it's not a fact that they actually work. So, of course, there is demand and there are products on the market. That's just the capitalist mindset. But the idea that some supplements can replace movement for us simply doesn't exist a priori based on physiology. As I said, if we don't walk, then this pump doesn't work. The disc doesn't even try. No supplement can provide nutrition to your spine. That's why there's this code of conduct that, well, some people try taking collagen. There are 28 types of collagen, and honestly, I don't know which one you need or why you're so sure it will end up in your spine. It will be broken down into the simplest amino acids in your stomach, in your gastrointestinal tract. Some people take various chondroitins, chondroprotectors. There are a lot of things on the market, but none of them have proven effectiveness. So while you might still debate the use of supplements for other parts of the body, when it comes to the spine, definitely not. After all, it's a mechanical structure and it needs to be maintained mechanically.
listen, since we're talking about your chosen profession, how did you actually get into it? Where did you undertake your studies?
Well, that's quite a long story because I'm still actively learning to this very day.
I'll say this.
I believe that if you work with the human body, you have to keep learning your whole life. But I believe that if someone is involved in treatment, they should have some kind of medical education, some sort of medical background, or at least, I don't know, even a sports background. For example, I started out with massage over time. Basically, I identify myself as a massage therapist because my mom is a massage therapist. Yes, hi mom, she's also a doctor, and actually she's the one who got me into this in the first place. And over time, I realized that I needed some kind of foundation. First, I enrolled in medical college, then completed medical massage courses, became a physical therapy instructor, and after that, I kept improving my qualifications. And here, for example, I completed training in physical therapy, meaning I work as a physical therapist after injuries, surgeries, and so on. That's why I have quite a lot of specialized education. I often communicate with different doctors, surgeons, trainers, and so on, and we can refer someone,
Or then,
redirect them.
by the way, you have contacts. For example, I had friends come from London, and you knew who to contact in London.
Yes, I have a friend, a physical therapist. We studied together in local and international courses.
So it's networking through courses.
Yes, exactly. And now, moreover, I'm already teaching massage myself. We're creating a platform for training at the Yutun Sanets Academy. We'll be teaching a new generation of massage, without myths, with a scientific approach. We're recording podcasts. Yes, check it out too. The link will hopefully be in the description. We'll add it. There we record podcasts about a healthy lifestyle, inviting athletes who often come to see me. I invite them in to talk about physiology, share some life hacks, and so on.
Guys, I hope this episode was useful for you. All useful links will be in the description. Subscribe to the channel and may your back never hurt. Ciao. Stay healthy.